3:01. So we can go ahead and get started. Welcome, everybody. It's March 1st. Believe it or not, I don't know if anybody else thinks it feels like it was just New Year's Day the other day. So let's welcome to our March housing navigation meeting. I'm going to try and go ahead and share my screen now. We've got several things to cover. Come on. It will. There we go. Here we go. Everybody can see this. I hope someone nod or something.
Yes, we can see it.
Okay, gotcha. Gonna go over a couple things. Most importantly, our recent point in time count. And then hold on one second. I'm sorry, someone's in the hall on speakerphone. I don't know if okay. Coordinated entry referral process with some new interesting and hopefully very helpful direct program and not organizational options for referrals and how to follow up on those. We'll talk about some agency updates and some things we got coming up. So let me move this. Most of you may know that, or hopefully all of you do know, last week we did our annual point in time count. And looking at the numbers, I hit too soon. It looks, we were looking at about 244 that were enumerated last week. Those are projected numbers because we did add some to the surveys that we did. Thank you to those who were able to come out or organizations we went into, be them shelters or other homeless service providers. We are continuing to survey folks this week that we encounter, asking them where they were last Tuesday night, if they indicate they were unsheltered, because we think that the count was too low. We are going to go ahead and count them at the risk of being over versus being under and not have a true picture of what's going on in our community. Any comments, concerns, questions about the point in time count? Again, it's a data analysis and digging through and finalizing numbers is going to take a couple weeks. But interested to hear if anyone has anything to say or what their thoughts are on how it went.
What was the overall number again, ma'am?
244.
244. Thank you.
And again, I think that's a little low, to be very frank. We were projecting early on based on intakes over the past year and those kinds of things, about a 10 to 15% increase over what we had last year. And as you may see on the screen, it's only 2%.
Okay, I was thinking, I'm home. I'm on a Zoom work call, but it's me that's here.
Okay, if you're not,
I'm on a Zoom work call. I was just
please
looking
mute
on.
your phone or your computer. Thanks.
Excuse me, out of that count, how many veterans were there?
It's 3.
Hang on one second. I'm going to stop sharing real quick and I'm going to go. I want to say there were 9 that were, but if you'll give me just a second, in fact, when I pull it up, I will share it with everybody. It is from our, the app we use, it's from the command center that shows you the real-time information. So hang on. And I'm just going to pull a new report right quick, right as we're doing this together. In fact, I'll share it as we go through. Share what I'm doing here with you. Where did it go? Okay, it's not letting me. So let me get to it, and I'll be right back. While you're waiting for me to do that, any other questions, concerns, comments about how it went? In fact, we're putting together a group to assist in planning for next year, not necessarily the committee, but a focus group of volunteers and organizations that have participated or want to participate or have some input. So if anybody would be interested in participating in such a thing, they'll need to contact Denise. And Denise, if you'll put your email in the chat box, that way we can put you on the list. We will be meeting in the next couple of weeks to start looking at best practices. How do we follow up with volunteers? What information do people want? What do they not want? Those kinds of things. And that report is running now. Mr. Morgan, tell you how many veterans were enumerated on that date. Although it's running really slow for some reason. All right, here we go. I'm sorry, I was off. It was 11, sir.
Okay.
And if I can, there we go. This is the report that I just ran right here. And you say here, there's only 204. We have some folks that were in shelter that were not completed on the night of the count that are being done, those surveys. So that accounts for the extra 40. But here's the veterans right here. Chronically homeless was 43. So moving on from that, let me go back to my slide here. So we're going to talk about, like I said, a coordinated entry. And then we've been talking about having changes to the matrix, and the matrix is constantly being revised and updated as programs evolve. Those kinds of things are happening. Not one of those things where you do something that sits on its shelf. You have to constantly update it.
Pat, we're getting a lot of background noise from somebody. It's very hard to hear.
Yeah, I was just gonna say, anybody not talking, if you would please mute yourselves, that would be great.
I was going to try and see if I can mute everybody. I'm not able to here. I think Denise would have to do it. Okay. Try this again. So I'm going to open up the coordinated entry matrix. And don't think you're seeing it right now. Let me. Nope. Okay, it's not letting me open it up. Hang on one second, be patient with me, I apologize. Oh, there it is. I just had to scroll down just a little bit further. Okay, this is the matrix as it is. And I'm gonna move this over a little bit. The first column obviously is whether or not an organization is accepting referrals. Then it drops over to columns E, F, and G to talk about those target populations. The first one being a veteran. Mr. Morgan, if you'll like this one, if we say yes, it automatically goes to VASH. We send all veterans to you guys first, and then they get kicked back if not eligible or whatever. But if that's a yes, that's the one that will pop up automatically. So that being said, then we're talking about whether someone is there we go. All right, whether someone is, whether it's all populations, households with children only, single female households, single male or females. So those kinds of things will then determine, like for instance, single females. We click single females, hit enter, and the programs that are just for single females then will pop up. So again, we're doing it based on the client's demographics, and then it goes into other determinants of whether or not they're homeless or at imminent risk, other statutes, whether it's a HOPWA person with HIV or AIDS, or those kinds of things. So these are going to be the program matrix. as it is today. And again, we're in the season where we're updating all projects, all information. So we'll be updating again as you guys are getting your forms probably in the next 2 weeks. And we will probably be doing quarterly updates just to make sure everything stays current, to ask someone to, hey, when you make a change, let us know. We all know everyone's so busy and has so much other stuff to do. So working together maybe once a quarter just to go, hey, just making sure there's no updates, kind of thing. And having the, the turning on and turning off of referrals when you're trying to, clear off your caseload or whatever, you need a couple weeks or whatever, we can turn those on and off from right here. So that being said, once the referral comes, if you all remember for many years, the client track referrals went to the organization, and then the organization had to distribute it to the particular program that it belonged to. And it's because coordinated entry evolved quicker than HMISs have evolved. So we have, I say we, Charles and Wally with Ecovia have done a workaround to where, and I'd say workaround it, what it is each of the projects is set up as the org and the project, until which time as the HMIS catches up to do it through organization then project. So they have developed it where each of your projects will get a direct referral to the person who's responsible for that project. So that being said, let me go back to, let me move this and go back. You all are aware or familiar with the referral email that you get when you get a referral. Those will not change. Come on, there we go. And we did one here just to walk through. You can see that the referral for the referral indicated here was for tester. And then when you look at that person's referrals on their sidebar, you click referrals, you'll see that they were sent a referral to your organization and what it was for. And if you'll see here, and I don't know if it's just small on my screen, but if you'll look down at this, you'll see housing at the first one, which is what you're familiar with, which you've always seen. It's just been housing because every housing program was clumped together. Well, they have all been divided out according to their project type. So if you'll notice the one underneath, it says referral to rapid rehousing project resource opening. That is so it can go specifically to that project that's appropriate. And then of course, the project name is next to it. That's how you will see them going forward. And I'm going to go back here to the matrix for just a second, and I'm going to take off this filter real quick. And but if you will, thank you. It's been a long time coming, but it has finally happened. I'm not going to tell you the headaches and the heartaches to get there. But if you will notice this area where I'm clicking here, this is how it will appear on your referral list. And this is the type of referral that happens. That is a CE event. And I'm going into the weeds with you, but going forward, each program and each community will eventually be doing coordinated entry, APRs, and everything else. So getting ahead of the game now and knowing that we're tracking, it was a referral from coordinated entry to a rapid rehousing project. And then what was the outcome? Oh, sorry, wrong one. What was the outcome of that project? So once we have the referrals here, if you click on it, come on. Okay. You're gonna click, if you click the action wheel, the little blue button next to your enrollment, or I'm sorry, next to your referral, you can click edit referral or the referral outcome. The referral outcome, for you guys who are familiar with having to do an appendix J, which is a denial or a rejection of a client for whatever reason, doesn't qualify, didn't make their appointment, unable to contact whatever. client self resolved, or client accepted, you know, client appointment made, whatever. This is a way you can alert coordinated entry of what's going on without having to do it here, do a case note, and then do an email. This is the one-stop shop for all of that.
Woohoo!
So, come on.
Coordinated entry meeting. United Way is the lead coordinated entry agency for their area in the state.
If you will, if you're not talking to the group, can you please mute
Registered.
yourself? Thank you. So the coordinated entry referral, you'll see that you can acknowledge the referral. And it's just a way of saying, of course, we know Tammy is our coordinated entry administrator here. Tammy, I got it. We're good. I got it. And it's another way from avoiding yet another one of those emails going, hey, did you get it? Hey, what's going on? Here's your acknowledgement of the referral. Why does it know? There we go. You can also put in there the appointment date. Again, a way to avoid that having to make yet another case note and everything else. It can be right here. Acknowledge and the date of the appointment with your client. Or back to what I was saying earlier, the client doesn't qualify. The client indicated, excuse me, the client indicated on their intake when they were talking to coordinate entry and they did their housing needs assessment that they had minor children. Well, when you're talking with them to set up the appointment and you're confirming the information, they go, well, yeah, but my kids, I don't have custody of my kids. They live with their dad. And your program is only for families with minor children. So you have to do an Appendix J and send or reject that referral, send it back to coordinated entry so that, excuse me, pollen, it's killing me. So that referral can be sent to another project that might be more appropriate. So you can reject it right here. It also, you still will need to do the Appendix J because we will need to have that in client files. But this way, you don't have to do the upload and then do the email and all that other stuff. You can do it right here. If you hit reject and save and close, it automatically comes to Tammy. So she knows immediately to look for that Appendix J and go ahead and do that re-referral of that client.
That is awesome. Great. Thank you.
I'm going to take a sip of coffee while you guys think about questions. Oh, come on, Ginger. I know you got something.
How you gonna call me out? So
Ginger
just
always
so I'm,
got something.
I know, right? I've always got something. So just so I'm clear, because I've got some new people, case managers that are on as well. For the first time, anytime that like if we try to contact a client and we're not working with them, we always send the referral back. If there's been no contact, we've, tried to reach out to them, that type of thing. We always want to send back the referral. And that's, like you said, that's where we can do that here from now on and just upload the Appendix J or the I and keep it moving.
That's
Awesome.
correct. Now, remembering that you have 3 days in which to start trying to contact the client.
Okay.
And you need to make at least 3 attempts to contact the client before you close it out. You can't call
And
them one
case-
time and say can't get them.
Right. And we case note. Yes,
Yes,
ma'am.
Yes, ma'am.
Okay.
Yes, ma'am. Any other questions on coordinated entry? Oh, I just want to say thank you, Charles, for working so diligently to make it all happen. I mean, it's been a long time coming. We had lots of obstacles that we had to overcome and some software issues that had to get resolved. And so thanks for making it happen, and thanks to everyone with their patience. And again,
Awesome. Thanks, Charles.
as soon as we all get used to this, then we'll figure out another and better mousetrap, and we'll be adjusting again. But I think if we don't continue to grow and make progress, we'll be stagnant.
I would like to add to that and say, hey, look, I am only one person of many who have made this happen. I didn't do it by myself.
So,
Pat, I believe there's a question from Antoinette, maybe?
yes, ma'am.
Hey, can y'all hear me?
Yes, ma'am.
Okay, so that I'm clear, to get to the coordinated entry or to the screen that you have shown us, that's on the HMIS, or how do we get to that screen? Because I've never seen that before.
Yes, ma'am. It's through, you get a referral, and it's in your clients. And if you'd like to go through, with it step by step, we can certainly set up some time. But basically you're in a client, and when you circle that little action wheel, I'm sorry, no, that's the enrollment. When you're in client track on the far left-hand side, it says enrollments and referrals. You click on there and it will show you the referral, and you can go from there.
Okay, will you guys let us know when you have some more training like y'all did before?
Yeah, we can certainly set up some training for later in the month, to go over it with anybody who wants to. We have our normal HMIS committee meeting later this month. We can probably start a little bit early and do some training. Sure.
That would be
Thank-
great too, Pat. If you can also let us know, like I said, I've got 3 new case managers, really. That would be great. Thank you, Pat.
Sure, we'll send it out to everybody.
Thank you so much for everything.
Sure. Okay, we're moving right along. We'll be out of here in 30 minutes today. Any announcements, anything upcoming, any updates? I know Cheryl, you're with us today in your new role officially. So I don't think you've been there but a couple of days yet. So you're probably still getting your feet wet and figuring out what you're doing, but talk to everybody what you're doing. And we're gonna put your information that you sent us earlier. We're gonna attach it when we send out the slides to everybody. We'll include that with it.
Okay, because and that we actually had an update on the flyer, so I dropped that in the chat for y'all. So feel free to download it. So anyways, yes, been here a week and already trained on the database, so I can get in there and answer questions. I am not a processor, so I can't process or allocate any money, but I'm able to just look in. Already been contacted by several people wanting to know what's up with their application, where they at with Georgia Rental Assistance, and that's my job, is to answer those questions, and then hopefully figure out how to get, if there's a barrier, how we can get past it. So I sat in the training with 18 new processors. They hire about 20 new processors every other week. So it's just, they're trying to get that backlog down because they still have a lot of backlog and everything from when they first set it up, and then they opened it up to the state, and it was just, there was a lot of applications. So, but anyways, feel free to contact me. If I don't know the answer, I'll find out, because that's just how I roll. And I'm here to, of course, do little 10, 15-minute presentations on GRA and what we're doing, and also to support the community. So I am in the same region that I was in before with DPH. So, just feel free to reach out to me if you have any questions.
Hey, Cheryl, I wonder if we can, I know that there were some agencies in town that were having some difficulties in getting things paid and all. If it's okay with you, I'll send you over a list of names and contacts of folks that I knew were having some difficulties,
Okay.
to see if maybe we could rebuild some bridges. I know there were some landlords that had some issues as well.
Yeah. And so I can't receive like private information on my emails because of
No. This was just a contact at the agency.
okay. So, and that's fine. Just let me know who we can help out with this. So
Sure.
and like I said, there was a backlog in the very beginning. They're working on getting it whittled down. Even the person that I looked at yesterday, I contacted the processor. She fell through the gaps. I mean, it just, because there's so many people, these processors have a caseload of, between 300 and 500 people. I don't know how they keep up with that. I don't see how you can keep up with that. So the system is still a little bit hard to deal with. So, because if you have uploaded documents and your case has already been closed, then there's no way to know that you've uploaded those documents. And so, just like I said, let me know how I can help to make this be easier for all of us. So that's what my position here at GRA is, just to be doing outreach and attend events, pass out flyers, just making sure that, we can get this money spent down, because it's a bunch of money. We need to go ahead and spend it.
Amen.
All right.
All right.
Question.
Yes.
Good evening. I came on a little late. I do apologize.
We expect nothing less from you.
That was cold. Listen, I was asking, you already talked about the numbers and stuff for the point in time count, right?
Yes, ma'am.
You already did. Okay. Well, I'll just get it from you later. That's what I was just asking.
Yeah, we're projecting at 244 now, but like I was telling the folks, we think the number's very low.
Okay.
And we are our outreach team and any agency contacts for the past week that we have an opportunity to ask the people where'd they spend the night last Tuesday night. They say they were outside. We're counting them simply because we think the numbers are too low.
Gotcha.
I want it to be as close to reality as possible. It's really great to go, oh, the numbers look wonderful. If it's not reality, we might as well not have done it.
So let me ask this question.
Huh?
For the ones that were unsheltered,
Right.
and let's say they're individuals, or let's just say they're families, how do we go about getting a like proof of homelessness? Because I noticed, like, with the hotel motel program, we've been getting a lot of people, and a lot of them, they'll call directly down here, but we have to tell them we have to have a proof of homelessness for them. And just in the past, I know sometimes they may be homeless, but they may not use like the Safe House services. They may not use PATH services. So it's kind of hard for them to, especially with children, they don't want to be seen in the public eye because they're scared of defects getting involved. So what would be what would you suggest that they have to show proof of homelessness? Because some of them don't even have a eviction letter. Somebody may have just put them out or whatever the case may be. And so that's what we're.
I can tell you some of the things that we've done. We had a lady who was staying at the hot dog place up here on Veterans. And we asked the owners of the agent of the hot dog place where she was parking her car every night to verify. We have asked our outreach teams, whether it be PATH or us, if we're in the area, one outreach team that's not mental health in the community can't take care of verifying everybody. I would suggest if the children are in school that they talk with one of the school counselors. It's not verifying it, but it's getting closer. And understanding that, and I know we got some folks from DCA on here, so please correct me if I'm wrong. When you're using DCA funds for for emergency shelter, non-congregate shelter, hotel, motel, it's not only literally homeless, but it could be at imminent risk, meaning they would be homeless if they don't get an intervention within the next 14 days. So there is ways to help verify. In fact, I sent one over to you earlier, Miss Kim. I sent a referral over. I hope I did it right, Miss Tammy. You were out and Kathy was not available, so I tried it and did it. And I asked the person, they said where they were parking their car. I said, well, you're gonna have to give me the address because someone's gonna have to be able to verify it.
Yeah, well, yeah, we spoke with her and she was pretty much just saying, well, what if I did sleep in my car? I was like, well, but yeah,
Well, I wasn't gonna put it out there, but by the end of the conversation, she had keys to a place, so
right.
I just let her
Okay.
talk. So yeah,
Well, like
that's
I said,
why we always say we have to verify it, and we do our due diligence to verify it.
okay, and that's why I'm just asking, because like I said, we want to help, but we just want to know how to help, and that we're on the same accord. That's all.
Right. And I'm going to tell you this: we have had great luck with the school district and the social workers and the McKinney-Vento department, that's a great verification as well. If the family is registered with the McKinney-Vento department, that would help you qualify as well.
And what is that exactly, Pat? I've never heard of
That's the
that.
homeless, that is the department for homeless students or those who are at imminent risk of homelessness within the school district.
Oh, wow. I didn't know that. Okay.
Yep. Well, that means we have to have them come. Maybe they'll come next month. We'll have them come and chit chat with us. It'll be Miss Brown or Dr. Nelson.
So like she was saying, the young lady that was just speaking, that a lot of times with kids, they're afraid to be in the eye because of DFACS and stuff getting involved. So do they just work along with this agency you just talked about with the homeless children, or how does that work, that they don't get taken from their
The
family?
school district works with the parents to make sure that the children have what they need to meet the needs
Okay.
of the children so that those things don't happen.
Perfect. Okay. This is great to know. I did not know that. Thank you.
In addition to helping with school supplies, clothing, as far as older students when they're needing caps and gowns and those kinds of things for graduation and everything in between.
That is awesome. Okay. Thank you.
Any other updates, announcements, anything else going on at any of the other agencies before we keep moving it on? All right.
If anybody has a link to that news interview, please send it to me because I have not been able to find it or catch it. Thanks.
Okay, you mean the one that you were the star in, Miss Kim?
That one too, but yeah.
Yeah, I can get you both of those.
Okay.
Yeah, I'll get you both of those. The Muskogee County Schools Summer Learning Program registration was supposed to open today, but there was a delay. The registration is going to open next week. I'm told that the registration is going to be open until the end of April. Again, that's what I'm told. I don't have anything, but I was asked to put it out there to be on the lookout for it. As soon as we get access to it, we'll send it out for those of you who did have families with children that are in the school district so they could register for the summer learning programs. We also have some information. We'll be attaching a flyer to the slides we send out here about Connections Matters training. Connections Matters is a training program for children who have had adverse childhood experiences, whether it be physical, sexual, emotional trauma, violence in the home, violence in the neighborhood, families with incarcerated parents and those kinds of things. How we as providers make the connections and do trauma-informed case management with those children and those families. We're going to have options available for all of us to have training. We have 2 certified trainers at the United Way. Some of us are going to training on Thursday, not to be trainers, but to get trained on how to approach children who've been through traumas. And you can put it in the chat or shout it out or whatever. The program, the training program is a 4-hour long training program with a break in the middle for a lunch that you're provided. Would it be too much for folks who want to go through the training to block out 4 hours? Do we need to split the training up into 2-hour sessions? Again, they just wanted us to get some feedback on that so that they can start looking at training opportunities going forward in the next couple of months.
Pat
Personally
Esau has
speak-
some information.
I'm sorry.
Did someone else have a comment?
Yeah, go ahead. I was going to let you go ahead. I'm sorry. Go ahead.
That's okay. I was just going to indicate that Esau had some information in the chat if y'all would like to review that about utilizing DCA and ESGCV CARES funding.
Self-certification of homelessness. Yep.
Yes.
Yep. Absolutely. I was waiting for you to say it, Esau. Because we have an unwritten rule here, no more than 15% can be self-certification. Of course that's no hard and fast, but you've got to have exhausted absolutely your options to and by that means case note, that you've tried to verify, which brings to mind, and I'm going to go down my rabbit hole really quickly. There was an article in the New York Times about 2 weeks ago about, I'm sorry, it was 3 weeks ago, about an audit that was done on shelters in New York. And they had major findings because there was no indication in the files that the workers tried to verify homelessness on folks that they were turning down for their shelter. Just throwing that out there. But if you will, guys, let us know if you want to break up training into 2 sessions, 1 session for 4 hours or whatever.
I
I know.
know us
I'm
at,
sorry?
for my department at the Safe House, I think the 2-hour session would be more feasible. Yeah.
Yeah, I was thinking the same thing for several others, especially those who have are working with families with minor children, because I think there's not a one of us that's not short-staffed right now. So, so we'll be sending a flyer out about the Connections Matter training as well as part of the attachments for today's presentation. Uh-oh, here I am hitting the wrong button. Head data quality reports are due next Friday. Vote writers will be here for the ID clinic on March the 17th, St. Patrick's Day. And then our April navigation meeting will be April the 5th. Hopefully, by April, we will feel the numbers will be down enough that we can start actually having a hybrid meeting of Zoom and or in person if you choose to do so. Anything else for the good of the group? Anybody have any announcements? Got some information on, quarantine guidance and all those other things that we know is so important for us to make sure we always keep aware of. Also have some resources here. If you will, on the last page here, there's some information on landlord incentives that came out in the last week or so. That's some really interesting information that the folks at with the COC Landlord Engagement Committee are looking at and working with or looking to work with the new landlord engagement specialists with DCA and trying to enhance those relationships. So give that a look when you can. Again, slides will be sent out probably in the morning. I don't know that we'll get them out today. I don't know if the recording will be done, and we'll get that out to you. Any other questions, comments, concerns? All right, be on the lookout too, guys. Newsletters coming out this Friday, and we probably, I don't know if it'll be this Friday or in the one in 2 weeks, we'll be doing a poll of what educational opportunities we want to see for the rest of the year. Of course, we know we have our required stuff that we do. But equal access, VAWA, and those kinds of things, but other educational opportunities for the good of the group that might you're interested in, please put it in there and we'll see what we can do and come up with. Okay, we'll give it about 45 seconds if no one's got anything else.
Thank you, Pat.
Thank you, Ginger. Thanks for joining us, Esau. That's Esau, guys, from DCA. I think it's the first time you've ever been with us. Welcome.
My pleasure. Thank you, Pat.
All right, guys. Well, we'll get you out of here 20 minutes
pleasure.
early.
Thank you,
Y'all
Pat.
enjoy the rest of your day. Hopefully, see if you can get outside and enjoy the nice weather. Talk to you later, guys. Bye.